What should I expect during a cystoscopy for bladder health? If you are wondering what happens during a cystoscopy, let's break it down. A cystoscopy is a procedure that lets doctors look inside your bladder and urethra. It's often used to check for issues like blood in your urine, frequent urinary tract infections, or to monitor for bladder cancer. Here's what you can expect. First, preparation is key. Before the procedure, you might need to give a urine sample to check for any infections. The cystoscopy is usually done in a clinic or an outpatient hospital setting. Most of the time, local anesthesia is used to numb the urethra. In some cases, you might receive sedation or even general anesthesia, depending on your situation. Next comes the procedure itself. A cystoscope, which is a thin tube with a light and camera, is gently inserted through your urethra into the bladder. Your doctor will carefully advance the scope to inspect the bladder lining and urethra for any abnormalities like tumors or inflammation. Sometimes, sterile fluid is introduced through the cystoscope to expand the bladder for a clearer view. If needed, small tissue samples or urine samples may be taken for further testing. During the procedure, you might feel some pressure or a mild burning sensation as the scope is inserted and the bladder is filled with fluid. It's also common to feel an urge to urinate. The whole process usually lasts between 5 to 20 minutes. After the procedure, you may experience mild burning when you urinate, blood-tinged urine, or an increased need to urinate for a day or two. Drinking plenty of water can help flush out your bladder and reduce any irritation. While serious complications are rare, they can include infection or injury to the urethra or bladder lining. Cystoscopy plays an important role in bladder health and cancer monitoring. It helps with early detection of bladder cancer, especially if you have risk factors or symptoms. The procedure allows direct visualization of any tumors and helps guide treatment decisions. If you've had bladder cancer, regular cystoscopies may be needed for ongoing surveillance. There are some risks to consider. Repeated cystoscopies can sometimes cause irritation or scarring in the urethra, which may affect urinary flow. It's essential to discuss any concerns or symptoms with your healthcare provider to ensure proper care and follow-up. In summary, a cystoscopy is a generally safe procedure that provides valuable information about your bladder health. While some discomfort is normal, the benefits of accurate diagnosis and monitoring often outweigh the risks. Always follow your healthcare provider's instructions and report any unusual symptoms after the procedure.